Okay, we need for the assessment, we're going to start explaining for the assessment. First, we need to assess the patient's the ability to move. Next is we need to assess the patient's the ability to move unaided. Next is to identify whether assistive devices are available. Okay, next is for the analysis. We need to critically think about our data and its relationship to other data. Next is we need to identify specific problems and its modification in moving the patient, in doing the procedure. Okay, next is for the planning. We need to determine the outcome in moving the patients. First is we need to identify the alignment, whether it's in no abnormal stress in muscles and joints. And next is we need to plan the moving technique. Okay, next we're going to perform na yung implementation. So first we need to wash our hands, disinfect our hands. So I already disinfect my hands before entering in the room of our patients. Also, next is we need to obtain any assistive devices needed, and then next is we need to identify two identifiers. So doing this procedure, I already wash my hand, disinfect my hands to prevent contamination of the microorganisms. So good morning, ma'am.
Good morning.
Okay, so kindly state your name for us.
I'm Leandro Mahawa.
By the way, I'm Nelmarlene Puclarego, your student nurse for today. So we're going to do the Logrolling. Yung Logrolling po is ipapaside namin kayo ng tulong ng assistant para hindi ma-prevent yung further damage for your spinal cords. Is that okay with you, ma'am?
Yes.
Okay. So by the way, ma'am, my assistant, nurse Jenny Lavisa. Okay, so we're going to help you to move in the other position. Is that okay?
Yes.
Okay. So ma'am, yung first na gagawin, we're going to remove this the garment. Is that okay with you?
Yes.
Okay. Ma'am, can you do this? So ayan. So at the count, ma'am, assistant nurse, we're going to perform the side of the ganyan. So I'm going to do this in the head here, ma'am. In the head. Just your position muna, in position muna. No, it's not that. The clothing here. Okay, so I'm going to help you. Okay. So we're going to move the patient in the count of 3. 1, 2, 3. 1, 2, 3. Okay. So patient is already moved. So I'm going to go back here. Okay, so ma'am, we're going to sideways the patient. For the we're going to sideways the patient. I'm going to help. 1, 2, 3. So assistant nurse, you're going to help the patient in her back. So I'm going to get the pillows. Okay. So for the pillows, I'm going to place here for the assistant on her side. Okay, next. The other pillows I'm going to place here at the feet. Okay, so I'm going to elevate the feet and place the pillow. Okay. Here. Okay. We're going to make sure the patient is. Are you comfortable with you, ma'am?
Yes.
Okay. And then I'm going to place the other pillow here in her. Are you comfortable, ma'am? Okay. So we're going to do the blanket. make sure the patient is comfortable. So we'll make sure that all the devices are placed in a, okay, so I make sure that it's placed, and then next is I'm going to disinfect my hands. Okay, so I'm back. Good morning, ma'am. Can you state your name for me?
I am learning Mabawa.
By the way, I'm Nelmarlene Hoplerego, your student nurse for today. So we're going to reposition you again, ma'am. So is that okay with you? We're going to do the supine positioning. I'm sorry. So you're going to lay down flat position. Is that okay with you? Okay. So I'm going to first to remove this blanket. Is that okay? Okay, so I'm going to remove all the pillows. Okay, I'm going to start here at the back. Okay. And next, here. And then here. Okay. I'm going to place it. And then for the handrail, we're going to remove it. So, ma'am, you can flatten it inside this. Sit that way. And for the just okay. Are you okay with that, ma'am?
Yes.
So, I'm going to carry clean pillows here. I'm going to place the clean pillows here. The first pillow, I'm going to place it here. I'm going to elevate the pillow, the hand of the patient, and then place it here. Next is I'm going to place at the other side of the patient hand. Elevate the hand of the patient. And lastly, we're going to elevate the feet of the patient to make sure that she is comfortable above the head. Ma'am, can you are you comfortable, ma'am?
Yeah.
How about the pillow here?
Alright.
So we're going to place the blanket of the patient to make sure that the patient is comfortable. Are you already comfortable, ma'am? You need anything, you can ask me or call me. I will be back right away. Okay? Already, I'm going to disinfect my hand. Wait, it's very important to disinfect before entering to the patient. Okay, so good morning, ma'am. Nice to meet you. So I'm going to reposition you, ma'am. Okay, so we're going to do the front positioning. Is that okay with you?
Yeah.
Ma'am, yung front positioning is yung parang pabaliktad kang ihiga. Okay? Is that okay?
Yeah.
So I'm going to remove first the blanket. Is that okay?
Yeah.
And I'm going to remove these pillows. Okay? You can hide. Okay? So after removing the pillows, you need to, ma'am, can you, here. Can you side cross your feet? And then we can Let the hand upward, or we can do this. And do sideways the patient. We're going to sideways first the patient. Okay, so ma'am, I'm going to sideways you. Is that okay? 1, 2, 3. Okay, and then the other hand. Okay, so the patient is here. So this side of the patient. Okay, we're going to. So this is round positioning. So I'm going to return the blanket to make the patient comfortable. Ma'am, are you okay? I'm going to disinfect my hand after the procedure. Go. Use the outcomes of the patients identified the previously you have listed. The patient is aligned previously no abnormal muscle stress and stress to joint. The patient states that she is comfortable. Okay, so we're going to do the documentation. So we have two types, the narrative and then the flow sheet. The flow sheet is where being listed the positions where side to side positions and into its abdomen positions. And we're going, if the facility does not have a flow sheet, then we can use the nursing notes. Simply assisting a patient in moving up is not needed to be recorded. On a nursing care plan, take note on how moving the patient. If the patient's movement is significant, part of the general assessment. You may have to write a progress note about the patient. Activity.